Good morning, everyone. We are going to talk about diagnosis of pregnancy. There are three components how we diagnose a pregnancy. First are the presumptive signs, then comes the probable signs, then comes the final confirmatory positive signs. In the presumptive signs, we have signs like amenorrhea, nausea, vomiting, increase in urinary frequency, breast changes, increased pigmentation of the skin. These all symptoms a female presents with. Coming to the probable signs, in signs you will have a Higar sign. This uterine isthmus gets softer. Goodell sign. The cervix is getting softer. Both are seen at the 6 weeks. And all the other signs, which I'm going to tell you further, are seen at 8 weeks, like the Chadwick sign. Bluish discoloration of the vagina, cervix, and even vulva. Oslander sign. You see lateral pulsations on the vaginal fornix. The Palmer sign. You feel regular uterine contractions, also known as Braxton Hicks contraction. So these all are the signs, probable signs. Now coming to the real stuff, the positive signs. When you are sure it's a pregnancy. So I would like to talk first about the urine pregnancy test. It is based on the hormone HCG. HCG has two parts, alpha part and the beta part. Alpha part is non-specific, beta part is specific. So all that pregnancy test checks for the beta part. Now HCG can be tested in the blood and also in the urine. The serum one is quantitative and more sensitive, whereas the urinary one is qualitative and less sensitive. And even changes in the value of HCGs can tell you about the status of pregnancy. Like if the period of gestation increases and the HCG value is falling, it can indicate abortion. Or if the POG is increasing but the HCG rise is less than 33% than expected, it means it's indicate an ectopic pregnancy. So this was about the UPT and HCG. Now coming to the ultrasound findings. In ultrasound, it will you will find a gestational sac in the decidua, which present as a intradecidual sign. And this gestational sac appears when the HCG value is 2000 international unit. It can be seen on the transvaginal ultrasound, and if the value of HCG is 6500, it can be seen into trans-abdominal ultrasound. As the time passes, you can see yolk sac within this gestation sac at 5.5 weeks, and as further time passes, at 6 weeks, you can see even the embryo with a fetal pole in the gestation sac. So this was about the UG findings. So you can remember it like this: intradecidual sign, double decidual sign, and double pleb sign. And coming to how to diagnose a non-viable pregnancy, like if the mean sac diameter is greater than 25 and no yolk sac or embryo is visible, we term as non-viable pregnancy or a blighted ovum. Or if the fetus is present, coming to a term known as crown rump length. We measure it from the crown till the buttocks, and if the crown rump length is greater than 7 and you can't find any cardiac activity, then still the pregnancy is non-viable. Coming to other uses of crown rump length, it can be used for estimating the gestational age. Coming to the indications of USG, it is not mandatory, it is only done when there is a patient presenting with pain to rule out ectopic pregnancy, or if the LMP is not known, or if the POG and the size of uterus is not coinciding, or the patient presents with bleeding per vagina. And the best USG parameter for fetal growth is abdominal circumference, and best parameter for gestational age is the biparietal diameter after 14 weeks. Before it, up to 12 weeks, it's the crown rump length. Remember these one liners. Thank you for watching. I hope you liked the video.